Hi, friends. Thank you for tuning in to the Concussion Coach podcast. I'm Bethany Lewis, the Concussion Coach. I'm a neurological occupational therapist and certified life coach, and I specialize in guiding people through their concussion recovery journey. I am passionate about helping people understand their injury, speed up their recovery, and reclaim control over their life post-concussion. The purpose of this podcast is to help increase awareness of concussions and the impact they can have on a person's life, and to bring hope to people who have suffered a concussion and those who love them. I firmly believe that sharing stories and knowledge about concussions will bring important light and understanding to this misunderstood and often invisible injury. The information in this podcast is meant to bring that awareness and hope and is not meant as medical advice. The opinions shared are those of the interviewees and my own. If you are suffering with lingering concussion symptoms, I have created a concussion coaching program specifically for you. I will be your mentor to guide you through your recovery journey, offering help with understanding and managing your symptoms, setting achievable goals, and learning how to manage your own thoughts and nervous system in order to get control over your life again. If this program sounds like something that would help you or someone you love, sign up for a free consultation. In the consultation, you'll get valuable information and resources and gain hope for your future. Sign up for your free consultation at the link in the show notes or at my website, www.theconcussioncoach.com. Hi, friends. Welcome back to the Concussion Coach podcast. My guest today is Sharik Peck, inventor of the Rezzimax tuner, and we get the privilege of having his lovely daughter, Katira, join us as well. I interviewed Sharik back on episode 47, and we'll put a link to that episode in the show notes so you can find it quickly. It was a great conversation in which Sharik shared his own personal experience with injury and rehabilitation, as well as how this cool invention came about, and it's definitely worth a listen. Today, I wanted to bring Sharik back and find out more about the Rezzimax tuner and how it has been helping people around the world. I also want to say that since recording that interview back on episode 47, which I think we did back in January, I've had a lot more experience using the Rezzimax on myself and my family members and have gotten more training on how to use it. And I believe in this product so much that I've become an official Rezzimax ambassador. So if anyone listening wants to try one out, you can use the discount code Bethany Lewis, no spaces, to get $75 off of your purchase. And I will put that in the show notes. And I want to throw out there that there's a 100-day money-back guarantee. So you can basically have a free trial period in which you can test it out, see how you feel about it. And I think that's really helpful and encouraging for people to feel comfortable trying it, which the product is good. You're going to love it. So let me introduce Sharik a little bit more. He has advanced degrees in physical therapy and rehabilitation counseling. He has spent over 28 years helping people eliminate pain from their lives. Sharik experienced several disabling accidents, including a broken neck and back, a stroke, and a dislocated shoulder, and years of chronic pain. His research is focused on resonance and its effect on the human nervous system. The Pain Tuner Pro is the result of over 12 years of research and development, and it has been awarded 3 U.S. patents and 1 China patent. And there might be updates to that. I don't know. Does that summarize it pretty well, Sharik?
Yeah, it continues. It never ceases to amaze me how time flies and how much changes in a short period. Even since I gave you that introduction, new changes have occurred, and we've just learned, for example, that our latest research is going to be published in the next couple of weeks. So we're so excited for that.
That is exciting. And then I would love to have you or Katira introduce herself. You can introduce her however you guys want to do this. I'd love to. Let's hear about Katira, who's joining us here.
I'm delighted to introduce Katira. Katira is my daughter. She's also the star on most of our videos that show the techniques on how to do the Rezzimax activities for all kinds of conditions. And no, when we were in Australia recently, we did not put a tuner on a koala. That might have been illegal there, but we did see one out in the wild.
We did.
But Katira is a registered nurse. She is working towards getting her nurse practitioner's degree, and aren't you?
Yeah.
It depends on the day if she goes through her classes or not. But she has been around Rezzimax since the days of us building these devices in our garage, and so she has watched it change many lives. Just an interesting thing about her, she's getting married in December and planning to move to Minnesota. I don't know why anybody would want to move to Minnesota in December. Those are her plans with her betrothed. Is there anything I missed? Should I tell them anything else?
I think that's about it. I mean, it was probably about 3 years ago that I really started looking into Rezzimax and seeing how it was helping a lot of people, it was always just kind of something that I used for playing sports and stuff, but I wasn't really. I mean, I'd help my teammates if they had sore muscles or if they got injured, but it wasn't really something that I had looked into doing career-wise until like 3 years ago. But then I saw how much it helped so many people, and I realized this is actually a really cool thing, and I've just been blessed to be born into it and find it so early in my career.
That's so cool. And do you feel like have you seen it be helpful for patients that you've been seeing as a nurse? Are you able to incorporate it there?
I cannot technically because that's out of my scope of practice. It's considered a therapy, but I mean, some parents have asked me about it and they've acted very interested and they've tried it on their own with their children and they say that their children like it, but I'm not supposed to do it unless they have a order for it.
Okay.
I should back up and tell you just a little bit further. She's a pediatric nurse right now, but she only works with very fragile children that are on ventilators and G-tubes and different things poking into their body, so they're fairly fragile. She's definitely worked on a lot of other individuals and
yes, I
kiddos
have worked with other people outside of my job that I have as a registered nurse. I've worked with a lot of patients just with Rezzimax and stuff. And I have seen a lot of people who have had a lot of benefit, as well as just friends and teammates too. I have a lot of people like, hey, can you get me the neck thing? Or they'll text me when I was in college and they would just text me and say, hey, can I come over and use that one thing? And I'm like, yep. I probably brought like 3 with me to college, and I was at one time I was like, I don't even have one for myself.
Yes, that's how I have 3 of the Brain Tuner Pro, and yeah, I have only one at the moment because I've lent the other ones out. So yeah, I get that.
She does have one other thing that I thought I should share. She's a 3-sport athlete from college. And so she did have an awful lot of experience in sports injuries and recovering from those. In fact, she, just to be like her dad, dislocated her shoulder. And in fact, wrestling, she was out in Iowa and wrestled for school out there, as well as played soccer and ran track. So
amazing.
she's been very busy.
Yes, that would keep you very busy. My goodness. And I imagine that the Rezzimax has been very helpful for you in your experiences as well. So that's awesome. I would love to hear more about that as well. First, why don't we give people a brief summary of what the Rezzimax is for those who haven't listened to the last interview yet and don't know.
Oh my goodness. We should have them go back and listen to your last interview. That was such a fun interview.
It was fun.
It was our first real meeting, wasn't it? Face to face there.
Yep.
Well, as a physical therapist, that's my background, and I've been one for 30 years now. I've spent a lot of time trying to help children and adults try and rehabilitate. Going back even further, as you mentioned earlier, I've had a stroke. I've had to learn to walk again. I ruptured a vertebral artery when I was in high school. Most people don't recover from those. And so I've had a miraculous set of experiences that have brought me to where I am now. Fast forward a little bit, I've got 7 children that I've been raising. They're all just as good as this one. But we've been working for years to try and help people with chronic pain and chronic conditions. And it's now been almost 14 years ago, my very first experiences with this. I woke up during the night with the realization that vibration was a critical component to helping humans heal. And I have been trying to understand that message for a lot of years now. We've dialed it in further and further and further. But eventually what we created was a tool that could indeed help people heal from an awful lot of things. We took a spinning motor and we created a vibrational energy pattern that mimics or mirrors the purring range of a cat. Just something that is so simple, so natural, obviously uses that purr as a mechanism to help itself heal, but also to help others and other animals heal as well. That purring range has been near miraculous for us to use with our tools, and has helped so many conditions now. We now have various versions and things that we have made and created, more than 20,000 of those devices throughout the world now. I think last we counted somewhere around 80 countries that we've shipped things to. It's just been a lot of fun to see the growth, and something that's made, being a local, something that's made right here in Utah has been a lot of fun to do. Years ago, we created them out of country, but I'm grateful that 6 years ago we made the leap and started manufacturing right here, and we have never looked back.
Awesome. Why don't you tell us who typically uses this? Like when you're shipping it around the world, who are you shipping it to?
A lot of doctors use it, a lot of dentists, a lot of chiropractors, a lot of medical doctors. We're seeing more and more of those. In fact, we just spent a good amount of time with a cardiology team back east, and it was fascinating to see, even our mainstream medical practitioners are absolutely delighted to find something that helps with the chronic pain that their patients are suffering from. And we see it in schools, we see it in pediatric settings, in nursing homes, in just about every setting. But the thing I'm most excited about is homes. You have several children. I have several children. Each of my children has, a tuner at their home and has the ability to help their family with these devices. And I love being able to help families be able to help their children with these, and from very chronic conditions. From chronic regional pain syndrome to POTS or postural orthostatic tachycardia syndrome to you name it, just about any condition, we can find a way to affect it with the tools that we've created.
Yes, and I love that so much. And I was going to ask you this near the end, but let's go ahead and throw it out here right now at the beginning, and because it's true. I feel like as you could use this for so many different things. And why is that? Like, what if somebody were like, this sounds too good to be true? What's your response to that? How can it be so effective for so many different conditions?
Well, the thing about it is it just brings balance to the nervous system. Some things are you're not getting enough stimulation, like paralysis, or other things that you're having too much stimulation. And so it's finding that balance of the nervous system where we take your body's own natural healing properties and we just help enhance it and amplify it and help it remember how to work better. And that kind of is regardless of whatever the problem is. It's your body, we're helping your body find a way to correct itself.
Beautifully said. Yes. And I think that is so, like, when you can affect the nervous system obviously affects everything in the body. And so it makes sense to me that tapping into that and helping your body heal itself is the way to make changes for all kinds of different things. So that's excellent. Thank you. Did you have something else you wanted to say about that, Sharik?
I think she stated that extremely well. We're not really going after any particular condition. In fact, I don't hardly think of diagnoses. What I do care about is just simply bringing balance back to the nervous system. Because then all kinds of conditions, whatever label we put on them, but all kinds of conditions just kind of fall aside when we bring the body back to its optimal form of functioning.
Yes, so cool. So can you tell us, since we've had our last conversation, what have you learned? What new things have you discovered? And I'd love to hear you. Maybe we should start with this. Can you tell us a little bit about the research that's been done on it and where things are going with that?
You bet. So one of the first things is that our research on headaches, and particularly cluster headaches and inretractable or unretractable headaches that just are affecting everybody. And we did a study on that is has been accepted to be published in the journal Oral and Craniofacial Pain and Headache.
I think it's just oral
and facial pain and headache, which is a really amazing thing. It is the journal that is the head publication body for several medical and dental groups from here to Australia to Europe and even across Asia. It's got several different bodies that band together, and they study everything that they can find that will provide improvements to people's health and chronic pain. And we're delighted that they're going to be publishing that in the coming weeks.
Can you give us a sneak peek into what was found in those studies? Is that allowed?
Well, as far as I can understand, because I'm not a statistics professional and I don't understand everything, but essentially what they found is that those who use the device, every one of them seemed to have some improvements. And those who didn't use the device, well, I should say, in the study, we did it kind of in a cool way. We actually made some of our devices that lit up like they're working, but they didn't work. And then we used others that actually functioned. So the people doing the study and those in the study, everybody was blinded, so they didn't know, which group they were in. But it was fun to see the statistical analysis or the statistical reports on it show that just about everybody made significant improvements. So we studied them, having them use the device 3 times a week, 3 or 4 times a week for the first 4 weeks. And then I think it was once or twice a week for the next 4 weeks, and then not at all for the next 4 weeks. But we studied the effects for 3 months. And even after they stopped using the device, they'd gone a whole month without it, a significant amount of the individuals that were using it still had a lot of pain relief and a lot less headache days. And that's kind of neat, because you don't have, there's no medication that we've found that does that in chronic headaches. There's no treatment, that typically once you've done with the treatment, the headaches are back, right? It's nice to see that we're actually teaching people how to stop having headaches.
That's huge.
And it's going to be fun to share. I have not done this comparison yet, but I can't wait to do it. I'd like to have somebody that's really good in statistics to analyze the outcomes of our study and compare it to other research that's been done on headaches and other modalities as well as medications. It'd be nice to see a comparison. This first study just simply is trying to see the effects, but I think it will spur additional research. While we're on that, we have completed a second research study, and it just this past week was placed on the online repository, which means it's now, the data has been placed on there so that research groups or journals can look at it and see if they might want to carry the information from the research. So the second study was done on dysmenorrhea, which somebody told me affects nearly half of the population in the world in some way or other. I wasn't sure exactly what the term meant at first, but I've studied it since then. But essentially, it means the painful abdominal system that's related to the menstrual cycles. And I didn't understand a lot about that because I haven't dealt with that in my professional practice much, but it affects a significant amount of people. And then, unfortunately, just going through menopause doesn't fix it for most females either. It's a conditioned response that their body gets into having. So anyway, we're going to be excited to see that completed as well. I can only tell you this much about the next research project that is currently getting started at a major U.S. university and dental school. They're doing a study on using the tuner for TMJ, TMD, or temporal mandibular joint disorders, and seeing if fixed with an appliance will make a significant difference for the chronic pain that people are experiencing with all the jaw and facial pain.
Amazing. I love already it's like 3 vastly different but really significantly impactful issues that people deal with. This is really, really cool. I'm guessing with the dysmenorrhea, which again, basically is like bad period cramps, right? What was can you give us a general summary of what the results were with that?
Well, the neat thing, we had a discussion with the major researcher last week, and the thing that was probably the funnest to see or hear is he said, "Look, I didn't think that device was going to do anything for this condition. I had no idea." He said, "Probably the most important thing that we can tell the world is it works. It works for all kinds of pain in the abdominal system, especially related to the menstrual cycles. And in that particular study, we did a similar thing that we applied a protocol before the menstrual cycle, and for a couple of days during it, and then for a couple of days after. We did that. We followed a couple of cycles for these individuals being studied. And then we studied them for a couple of months after they stopped using the device to see the overall effect. And what we saw again was they had good results while they were using it, pretty good results after they stopped using it, but it started to have these diminishing returns. A month or 2 months afterwards, we're starting to see that it's not staying, which means there needs to be a longer training period for people. But just the fact that we can teach a person how to use a tool, and they can have a significant effect during the process, but they can also have an effect for quite some time afterwards when they're not using it, that's something that needs to be studied a lot more.
Yeah, that's a big deal. I love that. Thank you for sharing that. I'm curious what you were meeting with cardiologists about. How are cardiologists thinking of using this?
Katira, why don't you talk to us about that?
So the cardiologists were curious about the vagus nerve stimulation because the vagus nerve controls so much of the body and your autonomic nervous system.
And the heart.
And the heart. And that's where I was getting to. So a lot of dysrhythmias can happen in the heart, such as atrial fibrillation and so on. And so they were looking for solutions on how to help with these different dysrhythmias, as well as you get a lot of people who have like some POTS symptoms, but they don't quite have the diagnosis of POTS. And so these cardiologists are like, well, you're having heart symptoms like flutters and such, but there's nothing wrong with your heart. And so they're like, how do we help these patients who don't have something wrong with their heart, but also help patients who do have something wrong with their heart? And because they're both having heart symptoms. And so that's where we're kind of like, we've been trying for so long. We're finally seeing research saying vagus nerve stimulation can help with that. And that's kind of, if we had to sum up what the tuner was, we'd call it a vagus nerve stimulator. And so that's where they're wanting to use it with their patients and see the effects of atrial fibrillation, as well as flutters, as well as people who have those POTS symptoms, to see if it can help them with their heart symptoms that come along with it. And so that's why we were talking to the cardiology team.
Very cool.
And it goes back just a little bit further. We were invited there by a nurse practitioner who is a cardiologist, and her story is that she got the tuner first to try and help her father, who had chronic regional pain syndrome from some terrible injuries to his leg many years ago. And her mom was having palpitations and was under treatment for cardiology symptoms.
With her cardiology team. So it was the cardiologist's daughter. Like, her whole team had tried working with her mom, and we're trying to find a solution. And I'm like, I don't know, we can't help.
But then when she started using the tuner, because her mother at that point had been on a bed for 14 months. She'd not been able to get up and move very much, and she was hardly able to function. She had some significant, besides heart issues, she had tick-borne illness, and was having a real struggle. Anyway, she's got the tuner to start her mom getting over that. 3 days of use, and her mom started leaving her bed, and her energy started coming back, and soon they realized that it was one of the best treatments for when her heart would go into those palpitations and flutters, and
she would have episodes of AFib, and it would help bring her out of them.
Oh my gosh.
So they're interested in doing some studies on it, and it's just wonderful to see how one little thing after another just slowly leads us to people that can help us share the message with the world.
Yes. Oh my gosh, I love this. That's so cool. And I love that it's getting out there because people are seeing it working, and then they go and tell their friends about it, or like their cardiology team that they work with or whatever. That's
while we were out there, we went and visited this cardiologist mom, and she was like, a year ago, I couldn't even get out of bed. And while we were there, she made us dinner. She was walking around, and it was really awesome.
That's amazing. Thank you for sharing that. So tell us, I would love, I love hearing these things. And as you're talking about that, I don't know, it's just bringing up other things. I'm like, oh, I should use this on this kid for this and this kid for this. Like I'll throw out there that I've had, a couple of the things that I've seen, again, in my own family that has been super helpful is one of my sons has Tourette's as well as ADHD. And there was one night he was just really like, his brain was going too fast. He couldn't calm down and sleep. And he came in and I could tell he was like antsy. I was like, okay, let's just try the Rezzimax here. And he did the head and neck protocol. And it was so cool to watch. Like as he was using it, I could just see his system calming down. And by the end of it, he was calm, and he went off and went right to sleep. It was so cool. He was probably 14 at the time. And I thought that was really quite amazing. My husband has had really bad back pain, and we've used it on him, and it's been helpful. When I was pregnant, I had always back pain in one specific spot especially when I was like sitting too long or driving, especially when driving. And we went down when I was 8 months pregnant. We drove from Utah to Texas to see the eclipse, which was so cool. But that was a lot of driving, and I did all of it pretty much because my husband had to work on the way. So it was intense for my back. I will definitely say that the tuner, the Rezzimax made all of the difference. I think it made that trip possible for me. Like I would just sit it behind me as I was going, and it really, really helped significantly. So I'm like I said, I'm a believer. I've seen it do some pretty cool things, and I love the stories that you have of people who've used it for stuff. So there are a few things that I have talked to patients about. You'd mentioned POTS. I have patients who have some trigeminal nerve pain, vestibular headaches, migraines. And then I have other friends who have like dealing with seizures for their kiddos or autism. So I would love to hear like a story or an experience or how you've seen it help in those different things. So let's start with trigeminal nerve pain, if that's okay. I'm just going to bring up a few specific instances and hear what your thoughts are, or like what you've seen it be helpful for with these different cases.
Sure. I'll start with trigeminal nerve pain. Why don't you think of a condition that you could talk about what you've seen it with? But with trigeminal neuralgia, boy, it is one of the best things. But I tell people at first, never try and treat the side of your trigeminal neuralgia until you know how your brain is going to do. Essentially, by the time a person's developed trigeminal neuralgia, their whole nervous system is on fire with a tremendous amount of stress load. It's always there when a person has trigeminal neuralgia. I know because when my trigeminal nerve gets fired up, it's related to the stress response, and I get shingles in my trigeminal nerve. So I know what this is like from experience. And the more stress and the more my system gets fired up, the more I start having pain, and it shoots down that thing, and then I start breaking out in the little pustule things. And anyway, I know what that feels like. So what I've found is as soon as I start having trigeminal pain and start feeling that flare up, I start treating the other side, and I start figuring out what has got my nervous system so fired up. I start dealing with the stresses in my life, and I start working on, making sure that I'm well hydrated, got good food going in, that I'm working on forgiving whoever's causing me all kinds of stress in my life, and, the forgiveness and gratitude. And there's so much in the brain that is related to trigeminal nerve pain. But we will start treating by going to every part of the body that's not that area and get the brain to settle down. The brain is what starts calming down the trigeminal neuralgia. So you've got to get your brain happy. So we'll treat everywhere on the body that doesn't have pain while we get that settled down. And we have seen it now I've seen hundreds of cases of trigeminal neuralgia where we can get it completely gone in a very short time. But it takes a lot of work on other parts of the body to be able to be successful with that. So there's one area, and I should show you we came up with a new little attachment. I think you got one of these. We've actually changed it a little bit more and made it flexible.
So this is going to be audio only, so you're going to need to explain what this is.
I'll need to explain what I'm doing here, because this is an incredible new little attachment that puts a bite plate, a U-shaped pediatric sized toothbrush, essentially is what we use. We attach it to our tuner. You can get those on our website. And I'll put like a drop of lime or lemon or something, a natural flavor, onto the little toothbrush, put it inside the mouth. And while sending lots of information from the cranial nerves around the mouth, and the trigeminal nerve being one of the primary ones, I will also have them do some eye exercises that we've found are incredible for helping after a concussion to organize the brain. Essentially, we're going for 10 of the 12 cranial nerves at the same time with a 5-minute exercise. And this little mouth attachment is key to it. We have been hearing some amazing experiences from people that have chronic conditions. In fact, Katira, would you tell about an individual that we recently worked with in here that was going to the hospital, I think twice a month for their migraine cocktail, and her experience just after the first time of using that. Would you explain anything you can?
Yeah, so it was a nurse practitioner, and she came in because, she had nothing else that was helping other than going to the ER. And so her and her husband found out about us, and my dad reached out to him and was like, hey, if you come over, or did he reach out to you?
I think,
I don't remember which one.
Yeah, they reached out, and I said, if you'll come over today, because we're leaving tomorrow for Australia. I think that was where it was, or were we leaving?
Somewhere.
We were going somewhere. Anyway, they came over 8:00 at night.
And she kind of was like, I don't know how this is going to help me, but nothing else has, so I guess I'll try it. Mm-hmm. And she was using it, and she was like, she was in the middle of having one of these episodes and was like, I need help right now. And after just 5 minutes where she was at a pain of 8 or 9, she was like, oh, it's at a 6 or 7, which is still pretty intense. So he's like, all right, let's keep working. And so then he kept working for another 5 minutes. She's like, oh, it's at a 3 or 4. I've never had it go away this quickly without going to the ER. And then got it down to where it was a 1 or 2, which we can count that as acceptable. If the patient is like, yep, that's good, then we're like, okay, awesome. We'll go to what you think is acceptable. And so she said it was still at about that 1, but she texted the next day and was like, thank you so much for letting us come over. We're very excited and optimistic about the outcomes that can come from this.
And she'd had a 28-year history after a concussion. Oftentimes a concussion can be something that precedes years of these chronic headaches. But one of the things that helped so much in her case was doing these little tongue exercises with eye exercises, with a drop of lemon on there. And all of these things, and just this little 5-minute exercise helps to get the nervous system functioning a lot better. And I think, don't we have a protocol for that? A particular set of activities on the website?
I think so. It's under the new oral accessory protocol, something like that.
Awesome.
It's pretty
I
impressive.
think it's near the top of if you go to the recipes tab on the Rezzimax.com, under the learning and then the recipes, the oral accessory, I think, is one of the first listed at the moment.
So Bethany, I think this would be an important thing for your son to do now, because organizing those cranial nerves will help with the Tourette's. We know that. We've seen that in a lot of cases, the calming that it brings. But there's something really special about doing the tongue in certain motions and the eyes in those same patterns while stimulating the olfactory system, while stimulating, all of these other cranial nerves at the same time, and getting the upper occipital muscles involved in the same thing. You're getting your acoustic, you're getting just everything is remembering how to work, because it gets calibrated in this simple little exercise.
I believe it. I know they call it neural stacking at CFX where I work, that they using like activating these multiple cranial nerves at the same time really does make a big difference. So I love that you guys are doing this, and I imagine that the adding that resonance as well, the vibration will be really a key part of helping things. So I believe it. I think I should definitely have my son do this. So thank you. And is it the bite plate is the thing that's that oral accessory is really helpful as part of all of this?
Yes, but especially using that bite plate, and we'll bite down on it for about 5 seconds, and then we'll release it for 5 seconds. And we just do that over and over. So we're engaging all of the muscles that are part of the face and head. And we're also, engaging the eyes at the same time. It's all of this come together in a little 5-minute exercise that just helps in the organizing the timing of all of these cranial nerves, and they're firing to help. It has been a remarkable process.
So cool. Do you feel like, have you heard it helping with noise sensitivity at all?
Yeah, well, I actually have. I've had just a couple of people that we've worked with that couldn't hardly tolerate, a lot of the noises and lights. And both of those sensitivities, the noise sensitivity and the light sensitivity, those go away when we start bringing balance to the cranial nerves. And this has been such a fun little thing. I should mention that part of the reason that we got this little device finalized here in the last couple of months is because it's going to be a part of the study on TMJ, TMD. And TMJ problems are very much related to the tinnitus that people experience. Tinnitus or tinnitus, depends on where you want to live in the world, how you say that. But it's a big part of the tinnitus, and it's also a big part of the visual disturbances and the vestibular system. So I have been doing this twice a day myself. And I have realized something that has been just so fun, because for years, since my stroke, I believe, I have had a real hard time reading things. I have to read them and read them again and read them again. And while I'm reading them, words are jumping around the page, and it's hard for me to read things. So my kids make fun of me because all of my things that I read on my phone are in big print, because I want to make sure that I'm not making mistakes with, what I'm reading. And just in the past week or so, I've noticed that I can look out at signs a long ways away, and I can see them clearer. And I can look up into the mountains, and I'm seeing things clearer. But I noticed when I started doing this little exercise that my left eye that was affected by my stroke and my right eye still didn't quite know how to play together. And this is more than 38 years since my stroke. And so I have struggled with this reading thing for decades now, but just in a very short time, of doing these eye exercises with the jaw exercises, with all of the stimulation, I'm starting to see improvements in my own long-term symptoms.
That's amazing. And I do think that, I don't know, as you're talking about that, I'm like, man, so many of my patients and clients have had issues with, they don't even realize that their visual system is off track, that their eyes aren't playing nicely together. I imagine this would be really helpful for neuro-optometrists and vision therapists as well. I could see this being, if it's...
That's the group that Katira is going to go talk to next.
Yeah, we're actually going in 2 weeks, and it's a group that invited us to come be the only vendor at their conference in Colorado, and it's a optometry group.
Oh, awesome.
They're interested in helping all of their clients that come in with these brain injuries.
Their keynote speaker that they're having for this conference were the ones that were like, you need to invite them to come to this, because she says she uses our stuff all the time in her practice. So
it's pretty fun to start seeing more and more professionals understand the value of these therapies to organize the cranial nerves.
Yes. Oh, that's so awesome. I love this so much. I'm like, again, thinking of ways to use this with my kiddos. So I have a couple that I think this would be really, really helpful for. And actually, since I have you captive and I get to ask you what I want, I have a daughter who just broke her arm, is a classic buckle break from falling off the monkey bars. Would that be helpful for that? Like, how could I use it in relation to her healing that?
So that's one of the fun things that has been well studied, and that is the frequency range that we created. The cat purring harmonic range has been shown to speed up healing in fractures by 66%.
I will definitely be using it. Kay, tell me what to do.
So you can use it, you can have her hold on to it, because she'll have a lot of stiffness here, and all of the nerve endings that go through that area of the fracture, they also go to the tips of the hand and the fingers. So you can use it a lot here. You can use it, I don't know where she broke it, in the forearm, I'm guessing.
Close to the wrist.
Right. So you can use it above that and below that and just speed up the healing in that area. You can also, because I broke my elbow when I was a kiddo on a trampoline, and boy, you get some itchiness and you get some other sensations, and you get some lymphatic issues because things aren't moving, they aren't flowing. And so you can use that, scraping on the fingers, send sensory input straight through that fracture area and help speed up the healing. You can do it above it, you can do it below it, you can do it up here, just below the collarbone, to help with the lymphatic flow in the entire arm and hand. And the lymphatic gets stuck when there's not a lot of movement happening, which also slows down the healing. So the things that'll speed up the healing are the direct stimulus itself, which will help it feel better and move, getting the swelling out of there, and also just simply sending the stimulus through that area.
Perfect. Thank you. And she's 6. I just want people out there to hear this too. She's 6 years old. There's not really an age max or minimum on this, right?
No, we have it being used on newborns.
We have a doctor that said he's used it. He calls his son a Rezzi baby because he's used it since the day he was born.
I love it. What was he using it for? Just curious. Do you know why?
No, he used a lot of stimulus at the hands and the feet and the spine and the tummy. And he said, I would just rub that thing all over. Usually it's below the head level. You know, the skull's not thick enough right on the newborn
You want to
stages.
stay away from some soft spots on the head.
But everything below the neck, he said, was fair game, and he would use it on the fingers and the hands. And he said, I watched this little boy of mine become very advanced in his motor abilities because he had such, all of this messaging going to the brain, helping it organize his nervous system and his muscular system.
Also, just for some background, his kid was prone genetically already to have some neurological conditions like ADD, ADHD. And so he's like, I just want to give my child the best chance he's got.
Very cool. Yeah, that makes sense that it would help to organize all of that and be helpful for him. So cool. How about, like I said, I think I told you I have some patients who've had vestibular migraines. I know that one of them has ordered it. Before, like, we had a conversation together, and she didn't know how to use it necessarily before we chatted. But even, just using it intuitively, like putting it where it hurt and stuff like that, she said that she did feel like it made a difference. But we were hoping to get more use out of it by using like protocols that would be helpful. I haven't actually talked to them since. So it's been a little while. I need to follow up with them, but I would be interested in hearing how, like, you've seen it helpful with vestibular migraines and other kinds of migraines.
Yeah, absolutely. But what you were talking about brought up a thought that I would love to share. And that is that sometimes going right to the pain is not the best approach to calm it down. And if we had the chance for a person to watch the videos or things that we produce, you might look at in fact, we'll publish this very soon, but the protocol that we use for headaches in the study, actually, one of the techniques was at the feet. And most people are like, wait a second, why are we treating a headache and we're actually putting our feet on this thing? But if you think of it as using the nerves that go to the fingers and the toes and everywhere through the body as part of the treatment approach, you have all kinds of spots on the body that don't hurt, that can take messages up to the brain that help it organize itself and bring calmness to it. So, a lot of the things that we have found, if I were working with that individual, I'd probably start by placing it on her tummy or her feet and just engaging the vagus nerve a little stronger by having her hum and just improving her vagus nerve efficiency by getting that communication going on with the brain. That's the fastest way usually to get a person to start calming down. As soon as they start calming their system down, as soon as they take it down a notch or two, I'll jump, closer to the chronic headache problem spots. But the fastest way is just to get the nervous system to start settling and then going to all of the painful spots.
Something that can help with that is helping the body just know where it's at in space and scraping those feet and sending stimulation through the feet. That's helping the body be aware of where it's at so that it can calm down.
Yeah, that's really cool. And I think now might be a good time, since you kind of brought this up, I think, and you mentioned some of these before, but what are ways, you're using the tuner, you're putting it in certain places or scraping along extremities. What are the accessory things that you can do? Like you mentioned, forgiveness and gratitude and humming, and I know tongue between the teeth. Can you explain that and how those things all contribute?
Yeah, the most important thing is actually, I'm going to start with the tongue in between the teeth, because the trigeminal nerve is an opposite of the vagus nerve. The way the body works, the trigeminal nerve is very much keyed into the fight or flight and the survival mechanism. And the vagus nerve is very much keyed into the survival mechanism, but it's all about the rest and digest and live for another day. It's not about the battle going on right now, this instant. So in our chronic stress world, the fight or flight mechanism trumps when we're in a high stress state.
The body will always choose to stay alive rather than to heal.
Yeah.
Every time.
And because of that, just one little trick that we have found, putting the tongue past the teeth, causes a shutdown mechanism to occur in the brain. Essentially, it goes like this. The brain says, the tongue went past the teeth. Don't clamp down. Because
fight that off.
The brain likes the tongue for some reason. And when the tongue goes past the teeth and the brain gets this shut off the systems that clamp down message, one of those messages goes to that trigeminal system and says, do not bite down. And the biting down, as we mentioned, or getting the bit in the teeth of the horse or biting down and clenching our teeth or grinding our teeth, those are all associated with the stress response. So putting the tongue between the teeth and humming, which directly engages the vagus nerve. And humming has another really magical quality. It makes everybody slow down their breathing. It's really hard to hum fast, because to make a hum requires that you have breath for it. And that slow breathing is a very important part of cueing the brain to go into the calm down mode. So we have so many things that are part of these treatments that are all part of calming the nervous system down so that we can start to think and start to organize the brain a little bit better. And that's the process that starts moving a person towards pain relief.
And I love the point too about gratitude. Forgiveness, I think, is the first time I've heard you use that, but I could see how that would be helpful too. Like, it's like emotionally, physically, all of the ways you're just trying to help calm the system and tune into good things, I guess. Okay, so I know we're like really short on time. I knew I would have a hard time with this because I'm like, I want to ask you all the things and talk about all the things. But if you wouldn't mind just sharing a couple thoughts on how this could be helpful with seizures, possibly. I have a friend I was just talking to last night whose 11-year-old daughter has absent seizures, so she's not really falling down and convulsing usually, but she has these multiple times a day, and she's been on medications, and they worked for about 4 years now. They're trying all these different things, and she was like, with the medications, it takes months to like wean yourself off of the last one and then try the next one and see if it works. And so I was like, oh, I bet this would be a helpful thing for it. I'm pretty sure I've seen you guys talk about seizures. So if you wouldn't mind talking about seizures real quick, that would be fabulous. How could this be helpful?
One of the first things that we have found is that sending a lot of input to the brain from the extremities, just like with the headaches, sending a lot of input from the fingers and the toes and the arms and the legs, helps the brain to start becoming more aware of where it is in space. And as the body starts to sense and get this input from the rest of the regions, it helps it organize the brain. And the organization of the brain is what helps start decreasing the seizure activity. Now, one thing we do know about seizures is that the increase in stress kicks seizures up to a higher level. A seizure becomes a reboot for the nervous system. So when things are a bit stressed, and they can be stressed just simply by all of the visual stimulus coming in, or auditory stimulus, or there's all kinds of ways that the body can be stressed, as well as dehydration and other things. Or hearing,
or a hard day at school,
or hearing somebody yell at somebody, or observing a fight. I mean, there's so many things that are stressful for the nervous system. All of those can contribute to seizure activity. And so just simply teaching the nervous system how to de-stress, one of the things I'm sure we'll see one day, but I haven't seen it yet, is a decrease in current cortisol levels in the nervous system, which is a stress response. You'll see the adrenaline and the cortisol hit high. We're going to see in one of our future studies how this affects it, but we know already that using our tools calm down the nervous system, just as they did your son. If they can do that in a teenager, they'll do that with just about any person that has chronic seizures. So calming down the nervous system, giving it input so that it can organize itself. What we haven't done yet, but I'm fascinated to see, is if using that mouthpiece and trying to do some active eye exercises and some of those things that help organize the cranial nerves, I suspect that's going to be a fun study. I suspect we're going to see that have a significant role to play in seizure activity.
The other thing with that, like one of the current ways that they treat seizures that are not treated by medications is to do an implanted vagus nerve stimulator, which is very invasive. It's an invasive procedure. They implant something into your body. Again, this is an external vagus stimulator. So we're kind of doing the same idea of stimulate the vagus nerve to help prevent seizures. It's just instead of being implanted, it's external.
That's so amazing. How frequently do you think somebody would need to be using it to have an effect to maybe see the actual decrease in seizure activity? And I know it depends on the person. Like there's a lot of
there are so many factors, but we have seen individuals that we've worked with that have gone from several grand mal seizures a day, and over the course of 3 or 4 months gone to the point where they have one every 3 or 4 weeks. And we've seen other cases where it's eliminated them altogether. But again, everybody is very different. But we have seen and heard enough cases now to know that it should be tried on every person that has seizures to see if it can help them organize their nervous system, see if it can calm down that whole vagus system. And it works on so many cases with seizures. We're excited to see that studied someday.
But plus, just as a little disclaimer, there can be other causes to the seizures. Like recently, we had somebody who was close to us that was having these, what they were calling seizures, but they couldn't find the cause, but then found out that had like a toxic level of one of his medications. And so it's like, we're not really going to solve a problem like that where until you take away the offending factor. And so it's not like it's like a cure-all for everything. If you can find a cause that can be taken away, you want to do that first.
Well, and especially in seizures, there are so many tumors that are a factor. You've really got to go to the point of ruling out everything else. Mm-hmm. But if you can't see another cause for the seizures that's treatable, this is a very effective way to help an awful lot of individuals.
Mm. I appreciate you guys mentioning those things. I think that is important. And I assume it would be for the people that you'd seen it have really good impacts on. Were they using it like multiple times a day or like at least once a day? What kind of frequency were they doing it?
Most of them have used it a couple of times a day. These are mostly individuals that get it, that realize, and there's a training period for seizures a person becomes habituated to the chronic stress, they start having more of them. When they have that condition, you've got to train them out of the process. So it's something that several times a day, they may use it for a few minutes, and then they start to be able to back off of using it after they've trained the nervous system and they don't need to use it as much.
But so then they'll maybe go down to like using it every other day rather than several times a day.
Okay, cool. And I imagine too that tremors are a similar thing. I know I've had patients that's something that is not uncommon for someone with a brain injury to be dealing with is tremors. So it's a similar kind of thing, right? It's training the brain where the body is in space and helping it to organize the nervous system, and those things can calm down.
Right. There are other, obviously we don't use just the tuner and nothing else. We use lasers and we use other things to help provide energy into those areas that help speed up the process. There are so many important things, but our tuner is a great starting process for many, many individuals with chronic conditions.
It's also a really good take home because, again, like you said, with lasers, like those can be thousands of dollars, and people are like, okay, well, maybe my doctor uses it, but I can't afford to bring that to my home. And so it's a really good at-home therapy that if people are going in and seeing somebody, that they can do it in between to help further the progress and help it go faster.
Love that. Excellent points. All right. So we should be closing up here, but I really do want to at least address really quickly autism, because I know that seemed to be a big, there's been really good things that have happened for people who are trying to help someone who has autism. Anything you want to share with the world about that? I feel like this could be an entire hour-long conversation, but any main points that you'd like for people to hear about how the tuner has helped people with autism?
I think maybe we'll ask Katira if she's seen anything or heard anything in her experiences. While I tell you just one thing myself,
okay.
It's all about organizing the brain. It's all about that stimulus. On our website, again, you'll see techniques that help the brain organize itself and help the nervous system to calm down. And that is what helps so many of our children and adults with autism. Typically, there's a significant side of their brain that's well developed and another side that's not quite as developed. And this imbalance in the brain is what we see as the syndrome known as autism. And it's a spectrum because we're all different in our brain functioning. But if we can organize the brain, we can help tremendously with all kinds of things along the spectrum. And we've seen that. We've now heard from thousands of practitioners and individuals of what that's done for their children that they work with and in their homes. And we've seen some really neat things. Some of my favorites are when a family starts using our device and suddenly their teenage child starts organizing their brain enough that they can start speaking, that hasn't happened before. And there's just so many stories that we've heard. Do you recall any that you'd love to share?
Well, with autistic kids, it's not a matter, like, especially if they're non-speaking, like, it's been very well found that it's not because like they're not smart or anything. There's a disconnect between their brain and their body. They've found ways for them to be able to communicate that's not through speaking. And there's been books written by autistic people that they've written these books that are like describing what it feels like. And they're like, I'm just as smart as you are, and I understand things. I just can't communicate how I'm feeling or what I know. And along with that disconnect it's disconnected to their body as well. And that's where you'll get their stims, where they're jumping up and down and spinning around and doing their hand flapping, because it helps their body feel where they're at in space. So what we do is we'll scrape with moderately hard pressure to help them feel their hands and help them feel their feet and help them feel where they're at in space. Because when you can't feel where you're at and you're not understanding the world like you can see other people are, that's really scary. And so then they get these emotional outbursts because they're not understanding the world like everybody else. And so what we'll do is we'll do that scraping to help them feel where their body is, so then they can calm down. And then with their emotional outbursts, we will help just put it on the blue mode, which is very calming. So then they can hug it in a stuffed animal or have it on their bed, and it'll help them calm down from these emotional outbursts that happen. And it just helps them be more connected to where their body is.
One of my favorite stories, my sister shared with us of her daughter, very high functioning, but she comes home from school where she held it together at school. They're very good at that. But she would come home and unleash on the family and just all these pent up sensations and feelings. And she said we just couldn't stand to hardly be around her. But now her daughter comes home from school, grabs a little stuffed animal that has our tuner inside of it, and she turns that thing on and she hugs that thing sometimes for 30 or 40 minutes, and she can then deal with the world. It helps her organize her system, and it's been so fun to have that make a difference for our own family members.
Yeah, that's a beautiful thing. And I remember at the training talking or hearing stories from other friends and practitioners who that have used it with their family members or people that they've worked with, and just making a huge difference in helping calm those outbursts and just feeling like those kiddos can access the world better. I think it's such a beautiful gift. This is so wonderful. Thank you for sharing all of this. I love, we didn't even tap at all into the trauma, like how this can help with trauma. We'll have to bring you back again.
Another long session.
Yeah, that's an entire, like, that could be a conversation.
Aren't you going to Arizona basically just to do that for a
Yeah,
day?
do you want to come down? And we're going to teach a course in October just on trauma for trauma therapists and others working with that. And you should come down to Arizona. It's not quite as nice as Hawaii, but it's warmer than here.
Cool. Well, why don't we like at least do a nod to it? What does it do for trauma? How would somebody use this to help with trauma?
Well, it's the same concept of organizing your nervous system for chronic pain. When you apply that to the trauma process, if you think about where trauma comes from, when something happens, our brain wires around trauma. It's like it needs to remember every detail because it doesn't want to go through the same experience again. And the problem with that is that the nervous system does go back through these loops over and over and over again when a person's been through a hard experience or seen something that was terrible.
Every time you see something similar or sense something similar, or even just think back onto it, your brain goes back through the same hormones, the same neurotransmitters, everything that happened at the original event just comes back.
Yeah.
And it happens during sleep, and it happens during wake and watching a movie and all kinds of things. So what we do for trauma is we help teach the brain how to scramble the signal of the chemicals and the neurotransmitters through using our tuner and some simple exercises to shut down that process and reorganize itself. Essentially, we bomb the old experiences, so it's hard for the brain to bring them back up, and then we teach it to reorganize itself so that the memories are still there if they have memories, or the experiences are still there. It's just that the trauma is taken out of the experience.
You're not having the same release of the cortisol and the adrenaline that you had the original time that it happened.
You can have the memory, but you don't spike your heart rate. You don't start sweating.
How did you discover this? Like, how the heck did that come about? That's amazing.
Oh, that is a long discussion. Just briefly, I started experiencing for myself some things, adverse childhood experiences that I had. I wanted to be able to get rid of them. And I started applying, thought processes that were coming to me and using the tuner, and
as well as knowledge from your master's in counseling and
using all of these things and breathing and all of the things that I learned. And I started to come to an understanding of how to shut off the trauma response in the nervous system. And it has been phenomenal. We're going to learn a lot more about that in the coming days.
It's really more about the exercise that it takes you through and less about the tuner. The tuner and like Rezzimax just helps it stick faster and work a little bit better and easier for your brain to learn the pattern. But it really is about the exercise and the breathing and the thought process that the protocol takes you through, which you can find on our website again under that recipes. I think is it the trauma down regulation still?
We call it trauma down regulation, and sometimes we call it resilience with Z's for Rezzi. But resilience is really what we're encouraging in the nervous system to shut off that trauma response.
Awesome. All right, people, go and check that out. And that is the next thing I wanted to just talk about before we hop off is how people can access this information. So you mentioned the website. Why don't you tell us the website and where people can go to find all the details?
So the website is just www.rezzimax, that's REZZIMAX.com. And we have a lot of information there that you can find, especially under the Learning tab. If you're on a tablet or a laptop or an iPhone, you'll have to press the little plus button that's next to it. Otherwise, it'll just take you straight to like the basics getting started page. But if you press the plus button, or if you're on a computer, it'll just drop down. You can go to the recipes. That's where you'll find the protocols, as well as we have some classes that you can purchase and do online as well, just if you want some extra training on the whys and the behind the scenes of why we have those protocols, how they can, like what each point does, as well as some advanced ones that you can do, especially those for practitioners that they can use with their patients.
Yeah, and there's some great resources on there. There's even resources for how to use it on pets. We use it on horses and dogs and cats. In fact, we'll be speaking at the American Veterinarian Chiropractic Association meetings in Dallas later on this year, and presenting and sharing these techniques that work on animals as well. So that's all on our website.
We also have a lot on our YouTube under Rezzimax, but a lot of those will overlap. We have a lot of those YouTube videos embedded into our website that you can watch. And then also on YouTube, there's just a lot of different testimonials that you can find as well of people sharing their stories. And yeah.
Lots of great stuff.
Wonderful. Thank you so much, you guys. And again, I want to remind people that there is that 100-day money back guarantee, because I think that is really, again, helpful for me when I'm looking at buying something. It sounds great, but I want to try it myself before making any
Can I make a slight correction, Bethany?
Yeah, please do.
It's a 60-day money back guarantee.
Okay, thank you. 60
But
days.
I'll tell you what, any of your people that heard you say 100 days, I have no problem giving them longer time. By the way, we've been doing that and tracking it for years. We have less than 2% that ever come back to us because a person says it didn't help them.
Awesome. Yes, I like I said, I am a believer. I appreciate that. Thank you for holding the 100 days. You're welcome, people. So
I'll just add in, we also do have a 1-year warranty if anything goes wrong. We've had people who say their dog ate it.
We've had them run over.
We've had them run over it with their car. Whatever happens, if the vibration's just not sounding quite right, get it sent in. We'll fix it for free.
And I can testify these guys are really, really great with their customer service. So excellent. All right. Well, thank you so much. I will put these links in the show notes, and just really am grateful for your guys' time. Thanks for sharing this and for all the good work you're doing.
Thank you for taking the time to visit with us.
I'm so glad you listened in today. I hope you have gained some helpful insights and inspiration regarding dealing with and recovering from concussions. My goal is to create more awareness and education about concussions and the fact that there is so much that can be done to improve life after someone has had one. Help me spread the message by liking, commenting, rating, and subscribing to this podcast, and share it with others who would benefit from hearing it. There are more resources available on my website. And again, if you or someone you love would benefit from concussion coaching, sign up for a free consultation using the link in the show notes or at my website, www.theconcussioncoach.com. Thank you. See you next time, and take good care of that amazing brain of yours.